Welcome back. A polio immunisation campaign is underway in 4 African countries. Africa was declared free of wild polio virus in 2020, but Malawi detected a case in February. Now, more than 9 million children are to be vaccinated in East and Southern Africa. 3 more rounds of vaccinations will follow in the coming months, covering a total of more than 20 million children. To tell us more about this, we're joined by Unicef Eastern and Southern Africa's Dr. Saumya Anand. Dr. Anand, thank you very much for joining us today. Can you tell us how many polio cases have been detected since that first case in February in Malawi, and what scientists and doctors think could have been the cause of this resurgence?
So no further cases have been detected till now, other than the case of that 4-year-old girl child that was detected in Lilongwe, Malawi. The reasons why this case was found and why polio has come back is basically because this particular child received only 1 dose of polio at birth, but did not receive the subsequent doses required for full immunity. In addition, there is the contaminated water, poor sanitation, and also population movement, all of which contribute to the spread of the disease. Basically, till there is polio going on in any part of the world, children in Africa will continue to be at risk, which is why vaccination is very important.
So on that point of vaccination being very important, let's remind viewers who possibly have not been exposed to the ravages of polio for a very long time, since it's been pretty much eradicated, why it's so important to vaccinate against polio and what the effects of this disease are, especially on children.
If I recall correctly, the outbreak in Somalia in 2013-14, which started with a 2-year-old girl child being paralyzed. This was followed through that year with over 200 children being affected in Somalia, Ethiopia, and Kenya, including 1 death. So this is what polio is, and there is no cure for the disease. This is what makes vaccination the only protection. That's why it's called the 2 drops of life.
So this campaign in Eastern and Southern Africa is in partnership with the governments of the relevant countries. What role will Unicef play?
UNICEF supports vaccine procurement, cold chain management, training, and social mobilization, in addition to planning and monitoring to support the Ministry of Health in the countries.
And tell us, so another 3 rounds of vaccinations will follow this first round. Just describe for us how the campaign will be rolled out.
So we have been preparing for the last 1 month with micro plans being done bottom up on the ground, including for cold chain and social mobilization. Malawi has started the nationwide campaign today for 4 days, to be followed by bordering provinces of Mozambique and Zambia on Thursday, the 24th, and will be followed by Tanzania on the 27th. My appeal to all parents is to get their under 5 children vaccinated when the polio team comes to your door. In total, we expect well over 23 million children to be vaccinated over the next 3 rounds.
Can you tell us what the situation is currently in South Africa with regards to polio vaccinations? Are parents in general adhering to the vaccination requirements?
So in Malawi and in surrounding countries, the vaccination overall is very close to 90%, but there has been a dip during the COVID-19 pandemic. So this does put a lot of children at risk. Then there are other countries where vaccination is much lower, in countries like Somalia and bordering areas of Ethiopia and Kenya as well. So there are some pockets of under-vaccinated children, and that puts all the children at risk, especially when you have countries that have ongoing polio transmission, and that has never been stopped in countries like Pakistan and Afghanistan.
Can you tell us a little bit in more detail, in layman's terms, for ordinary parents, how vaccination rates that are perhaps not at the level we want to see in countries outside of South Africa could have a direct impact on children here in South Africa?
So it is important for us to understand that let's assume that newborn children who have absolutely no immunity will continue to be at risk. So the vaccination is very, very important, and to get it on time, at least 3 to 4 doses are required to get adequate immunity levels. People between countries travel, and people from Pakistan and Afghanistan, which are the endemic countries where transmission of polio has been ongoing for last several years, they will travel, and the virus can come into Africa as well and to anywhere in the world. So the children will continue to be at risk unless we vaccinate them with at least 3 to 4 doses whenever they are offered.
I know during the intense stages of the COVID-19 pandemic, we saw many parents hesitant to access local clinical and medical services in order to get those initial first and booster vaccines for their children. Have we seen a subsequent rise in the numbers of parents adhering to the vaccination schedule as the risk at healthcare facilities has dropped because we've been managing COVID-19 a little bit better?
So all the partners, including WHO, Unicef, and others, have been promoting the uptake of vaccine in Africa throughout this period, and the service delivery has been ensured. Of course, there has been a dip during the COVID-19 pandemic time, but now slowly that is picking up in most of the countries. And wherever it is not, there is intense social mobilization ongoing for it to pick up very, very quickly.
Thank you very much for your time and for speaking to us. That was Dr. Saumya Anand from UNICEF's Eastern and Southern Africa region.